Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello, welcome to today's presentation, Men Take Charge of Your Health. This evening's seminar will be given by Dr. Tam Nguyen, family medicine practitioner with Washington Township Medical Foundation. Dr. Nguyen earned his bachelor's degree at the Johns Hopkins University in Baltimore, Maryland. He then received his medical degree at Pennsylvania State University College of Medicine and completed a residency in family practice medicine at O'Connor Hospital in San Jose. In addition to family medicine, Dr. Nguyen is board certified in aesthetic medicine. And now, please welcome Dr. Nguyen.
Thank you so much for that introduction. And today we'll be talking about men's health, a topic that I have strong interest in and hopefully will help everyone here to be at better health, especially the men. So first, let's do a comparison between the sexes, between male and female, and what is the current state of health for the men. On average, men die 5 years earlier than women. Men have a higher death rates than women for all leading causes of death except for Alzheimer's. I guess we want to remember how we die. Men are more likely to be smokers, and as we know, smokers is one of the leading causes for many deaths. Visit the doctor less, and not only do we have poor health, we don't go and seek help for that, almost 100% less than women. More often, when we do present to the doctor, we have more serious conditions. Looking through the global health expectancy through the decades, in the 1970s, there was roughly 5 years difference. And as you can see, every 20 years, the differences increases up to expected in the 2030 of approximately 7-year difference between men and women. Here is a plot for the past century. As you can see, in the 1920s, both men and women lived roughly around the same. And since then, we've lost the race, men, meaning our life expectancy is much less than women. The top curve is how long they lived, up to roughly 80 years of age, while men will barely make to 77 years of age. As of today, roughly 5 years difference. If we were to break that down by racial ethnicity, you can see except for Hispanics, minorities, both men and women, live less than their counterpart Caucasians. And this is once again summarizing the overall mortality of men and women and separating by female and male, roughly 5 years difference. So what is the current state of men's health? Here's the top 10 causes of death in 2014 and very similar to today in 2022. The two biggest bars that you see right here is heart and cancer, malignant neoplasm. And these are the other 8. You can see that the bar here are great. Red is the men, meaning the higher the bar, the more we die from that particular disease. And then the gray is the woman, and this lavender, or this kind of light gray is combined. You can see that not only in these two causes of heart disease and cancer, not only is it great, the disparity is even greater as compared to some of the other diseases. So we would definitely focus on heart disease and cancer. And as you keep going down, the red is constantly higher than the gray, which means men have a worse case scenario for these diseases from dying from them than women, except for Alzheimer's, where the woman does worse. So heart disease, what is that? So here's the illustration of our heart. Even though our heart pumps all the blood, it itself needs blood to survive. So it has these blood vessels along them. When these blood vessels are clogged or blocked up by plaque, and most of the plaque, if not all of them, are caused by cholesterol, there's no blood flow through them, starving the tissue in the heart to die, causing a heart attack. Similarly, if this was the brain, you would get a stroke, meaning the blood vessel supplying the brain is no longer functioning well. So heart disease. More men die from heart disease than women. Remember, heart disease is the leading cause of death, both men and women. After 65 men, we are 3 times more likely to die than our counterpart. What are some of the possible symptoms? It's important to pay attention to these. So if you have them, please seek medical attention right away. Chest pain, of course. Constantly being tired easily, especially after a brisk walk or even just a short walk. Feeling short of breath on exertion, meaning just a simple walk. A pain or tingling in the arms, especially the left one. Fluttering in the chest, being lightheaded or dizzy. The symptoms may be a little different for female, but these are the classic for men. What are the risk factors? Having high blood pressure, high cholesterol, diabetic or pre-diabetes, not quite there, but almost. Smoking, being overweight, obese, and a family history of early heart disease, not simply just having a heart disease. The leading killer of men and women is labeled here. It's a little confusing because, not confusing, but it's, the blue right here is men, while down here it's the opposite, the red is men. You can see in all age group, men fare worse than female for heart disease, such as heart attacks. Approximately 1 in 3 men will have heart disease, which means 30% or more, 33% or more in any particular audience. And here is heart failure, meaning your heart is not functioning well. Once again, it's the opposite of the top plot. The red is men. And once again, the red is higher, which means we fare worse than our female counterpart. And something that may be important, heart disease can lead to ED or erectile dysfunction, which we will talk a little bit more. So we talked about heart disease. The second biggest killer is cancer. And once again, we win. Men have a higher probability of getting cancer than women. What are the 3 cancer? Prostate, skin, and lung cancer are the 3 leading cancer for men. So if you have any pain when you urinate, that's consistently, not just one time, and there's blood, and of course being overweight, and ethnic minorities such as black have a higher risk. These are the symptoms potentially of getting prostate cancer. For skin cancer, look for any moles that seem to change in size, shape, or color through the years. If the mole bleeds and it's a little harder to heal, and of course, if you were a sun worshiper or going to the sunbed, the tanning salon, these are the risk factors for skin cancer. And lung cancer, any cough that does not resolve within a few weeks should seek medical attention. The cough, even with a bad infection such as pneumonia, should not have blood, so therefore it should seek medical attention. And unintentional weight loss, not if you're trying to. And risk factor, of course, is smoking and asbestos exposure. Here's a summary of heart and cancer, the 2 leading causes of all people, both sexes. In these graphs are comparisons, so you can see that heart disease above 65, men is the highest, followed by 65, the same age group for female. In the same age group of 45 to 64, men is still higher. Hey, between 18 and 44, we're the same as female, roughly. Cancer, you see the same pattern. However, the only time that men seem to fare better than our female counterpart is between 18 and 44 for cancer. We get less of that, mostly because of cervical cancer. If we don't get prostate cancer, we can get something that's called BPH, or benign prostatic hyperplasia, which is basically an enlarged prostate. It's not cancerous, so it's not dangerous, but it's very uncomfortable and can affect our daily activities and living. Here is a normal bladder that holds the urine, and it goes down the hose to be pee out. The urethra, or the hole that pees, is surrounded by the prostate, which is illustrated in red. Through the years, as we get older, the prostate can get larger, pushing and compressing the hole that the urine comes out. Henceforth, we can't pee. Therefore, the symptoms is that because we can't pee all the urine out, we have frequent urination, and our flow is decreased, and sometimes it hurts to try to urinate. Men would describe they'll be standing there for minutes for quite a bit of time so that before the urine comes out. And because it doesn't come out too long, they never feel like they could empty their bladder. Half of the men, actually many men over 50, will get the one form or another of BPH. And by the time they're 80, almost every man will have BPH. and half of them don't realize they have it, and they'll just live with the symptoms. So hopefully after this presentation, you seek medical attention if you have any of these symptoms. Now, the other cause of death is suicide. On the graph over here shows that men exceed female in the rate of suicide. The middle is a combination. So between 2008 and now, we constantly outperform female in terms of suicide. This tells you what the cause is. For men, firearm is the biggest cause, followed by suffocation, poisoning, and others, compared to our female, which is the ratio is a little bit different. If we don't die of suicide, there are accidents. Men, maybe we're clumsier, or maybe we just don't pay attention, or overconfident. We fall more often, especially from ladders. Driving impaired, we're more likely to drive under the influence of drugs and alcohol. And of course, various forms of fire, both firearms and other forms of fire. Now, in terms of suicide, we're 4 times more likely to succeed in committing suicide than our female partner. And some of the causes or some of the symptoms that we should pay attention to. So spouses, if you see your man having depression, or that's especially if it's undiagnosed, being withdrawn, suffer a recent life crisis such as a heart attack, any personality changes, the feeling of worthlessness, meaning they're not living up to what they expect, not what you expect, but what they think they should do. And of course, increased use or just use of alcohol and drug in general put a man at a higher risk, especially after 65 years of age. Here is a plot of the different age group from 15 all the way to greater than 85. You can see that men, regardless of the age, have a higher risk of death by suicide, and it jumped exponentially after 65. If we get an accident, if we don't die, we have something called traumatic brain injury, which is injury to the brain that can cause a lot of symptoms. And that you hear this a lot in football player or sports that have a lot of head injury. Traumatic brain injury is 3 times more likely to cause problem than female. We go to the ER, man does, more than female. Here's a plot through the past 10 years that you can see men constantly have higher brain injury, especially after 65 years of age. And it is the leading, falls is the leading cause for older men, and then car accident is for younger men. Here is the age bracket. Once again, this line here is for men over 65. So you can see it's a clear gap until the next age group, which is 15 to 24. Surprisingly, the young and the very old is the biggest risk for traumatic brain injury or various forms of accidents. If we don't succeed in all the other stuff, then we take drugs to get overdose. For men and female, you can see that the men have increased over the past 10 years at all age group, while our female counterpart is much less through the decade. So what is causing all this? Our mental health. Men suffer a lot from stress, anxiety, and depression. Factor affecting our mental health is death of a loved one, divorce or separation, even if they may not exhibit any emotion, losing a job. Many men identify themselves with a self-identity to a job. A birth of a child, though it may be joyful, it puts a lot of stress. Being diagnosed with a serious illness, moving to a new home or a new job, and a natural disaster. And all of this leads to our personal sex health. Your sex life is a reflection of your overall health. The healthier you are, the better you will have, right? So when we have problem with our sex life, it's called erectile dysfunction, or ED, as we see many often in the commercial. It's caused by many things, both by heart disease, diabetes, medication, lifestyle, being inactive, and of course, many psychological stress, depression can cause this. More than 30 million American men will experience some form of erectile dysfunction. Then there is something lately coined as male menopause. As we may know, or may not be aware, female will go through a natural phase of their life when they'll hit menopause between 48 and 52. When a woman go to menopause, their hormone drops, their estrogen specifically. There are a few men, not all men, but more and more will experience similar called male menopause, where the testosterone will drop, causing erectile dysfunction and other poor sex health. So what are the contributing factors for all these worst outcomes that I've mentioned? High blood pressure is definitely one of them. Tobacco use, and of course the sugar level. As you can see, the dark blue is high income earners, middle income, and low. No matter regardless of your income, these risk factors are affected in all groups. And here's number 4, not being active, a couch potato, as you may call. So let's explore this a little bit more. We know that right now we're in the COVID epidemic, but inactivity is a global epidemic that's been going on for decades, if not in the past century. It's beginning worse. As I presented the data, that men's health is far separating, getting worse from our female counterpart. Here is the activity levels and the rate of death associated with it. So here's low activities versus moderate activities and high activities. You see that at low activities, the bar is higher, which means people die more. The blue is men and female. So therefore, in comparison to a female, if we have low activities, our rate is higher. As we move to moderate activity, which means exercising to around 30 to 50% of our basal heart rate, considered as moderate, then our mortality or our death rate drops, even though we are still higher than our female. And at high activities, being very active, then the death rate or complication drops even further. So of all the risk factor that causes death in men, smoking, obesity, hypertension, high cholesterol, and diabetes, being inactive is the highest and the biggest one of all. And you can see that it's greater than even hypertension and diabetes. So exercise is a simple form of medicine that anyone and everyone, no matter what state of health you are in, that you should participate and do. It's cheap. There's no cost at all. It helps address many things, both from chronic disease to simply a good sex life. Physician should prescribe it, and patient, please, you should take it. All of this can be a part of our stress symptoms. So what are the symptoms of stress? Headaches that's become more frequent. Stomach issue, nausea, indigestion, being constipated or diarrhea without any reasons or health implications. Being short of breath, having difficulty to sleep, either too much or too little. Emotional symptoms of mood swing, symptoms of anxiety, depression, and apathy. Behavioral symptoms such as being irritable, outbursts of anger, unable to control their mood, and the difficulty to concentrate. Some more physical symptoms as muscle aches, muscle tension, fatigue, backache, cold, shoulder, and of course, any drug use can increase the risk of stress. So a lot of these things can be addressed and should be addressed, but there are barriers to men getting them. So what are the stuff that we hear a lot? Men don't see doctor until they are in pain. They want to use home remedy first. If it ain't broke, why fix it, right? Well, depending on the consequences, we'll still smoke until I know I won't die, until the doctor tells me that my next cigarettes I will die. Of course, we can't say the next cigarette you will die from, right? Men will tell other men, go see a doctor, but they won't do it themselves. Why is that? Well, there's time. We are so busy in today's 24/7, high-stress, high-paced society. Men are bred to work hard to provide for their families, so they don't have time to take out from work to go to see their doctor. I need to work to pay the bill and take care of my family. I have multiple jobs. I don't have time, or I'm searching for a job to go see my doctor. Or I would rather make sure my family eats and I don't have insurance, or the copay is too high, the cost of medicine, or to pay for rent, food, or even simply to relax and have some entertainment. And there are not everyone, but some would rather spend money on things that they have a visual perception of success. So you can't see good health like you can with a car, jewelry or clothes, material possession, or a trip to Disney World. Health is competing with bragging rights of how people should spend their time and money. And they are simply not being able to make the lifestyle changes. The good news, what are good news? All of this can be prevented, and that we can catch up to our spouses if only we have prevention. It's better to prevent than it is to reverse the diseases. Many times it cannot be reversed once you have it. So what are some of the reverses? Go see your doctor at least once a year. And try to start early. Don't wait until you're 50. And since the last time you saw the doctor was the high school physical, and that's because you had to in order to participate in the sport. And take advantage of free community health screening, especially if you don't have insurance. And many employers have supplement to their healthcare insurance, many health services that you can utilize. Be a role model for your children. Take care of yourself so that you can take care of others. The American Heart Association have this something called Life Simple 7 things to do to have a healthier life. Be active. We talked about that. Get control of your cholesterol, and you can only know how to do that if you talk to or see your doctor. Eat better. Don't eat junk food. Eat healthy. The greener, the better, as in vegetables, not just green egg and ham. Manage your blood pressure. You can check that by many places. The pharmacy, healthcare, know your blood pressure and take care of that. Lose weight. Unless you're very, very thin, all of us can lose a few pounds. Reduce the amount of sugar that we eat. You'll be surprised what's all in the sugar. We live in a world of processed food, and every processed food has some form of sugar. Reduce that. And stop smoking. If you don't smoke, hey, you're ahead of the game. You only need 6 out of these 7. How do you prevent accidental death? As we talked about, one of the leading causes. Follow workplace safety guidelines. Drive safely. Man, we know this, right? Road rage. Follow the speed limit. Or try not to exceed 5 miles above the speed limit, right? Do not text while you're driving. Do not talk on the phone while you're driving. And of course, wear seatbelts. We know seatbelts save lives. Wear a helmet. We forget about this for bike, skateboard. These are some of the leading emergency ER visits, and of course motorcycle. Don't keep loaded firearms in the house. If you have a gun, please make sure the bullets are not loaded. Use careful ladders. I mentioned this, and power equipment. Many men have accidents because of this. So in terms of your health, screening is key to prevention and providing good health. Screening is doing tests when you have no symptoms, where you have no diseases, to make sure we detect them early. So between 16 and 64, these are national recommendations, not just my recommendation, that we should do. You should screen, or the provider should screen for depression. Hepatitis B, if you have this risk factor of HIV, drug using, men who have sex with men, and household in contact with someone who has hepatitis B, a husband or a wife who has hepatitis B. An HIV test starting at 16, and hepatitis C. Between 45 and 54, then we add colorectal screening to make sure that we don't have cancer. And that can be simply done with colonoscopy or as simply as a stool test. Once again, depression, hepatitis B, hepatitis C, and HIV as above as with the previous age group. And as you get older, between 55 and 64, you do all of this. Plus, then you start CT lungs cancer screening only if you have a history of smoking a certain amount. So if you smoke, we know that can lead to lung cancer. Therefore, a simple CT called low-dose CT scan can help detect this. And it's sad to say, I've detected many men who have lung cancer because of this, and they had no symptoms. Then, around 55, you start with the prostate cancer screening. Now, prostate cancer does have some controversy about when you should start or even if you should do it. But many association and national health organizations do recommend starting at 55. Between 65 and older, you do all the above, plus then what you do is called abdominal aortic aneurysm. Aneurysm is a blood vessel that bulges inappropriately. If it bulges too much, it can burst, leading to death. So this only occurs if you are 65 and above, and you stop at 75, if you ever smoked. So even if one cigarette, you need to do at least once. And once you're done and everything's good, then you don't need to do any more tests. If you do have an aneurysm, depending on the size, your doctor would then do annual every 6 months to monitor the growth or to have you have surgically corrected. So prevention with coping with stress and anxiety, exercise. We can't emphasize strong enough. And not just any exercise, aerobic exercise, so cardiovascular. Weightlifting and anaerobic exercises are important, but aerobic exercise is something that will help with stress and anxiety. Eat healthy, and please don't self-medicate with other people's medication or with drugs and alcohol. Ease up on the caffeine. Not to say you have to stop it, but ease on the caffeine. Too much can have many other health consequences. Sleeping appropriately, between 7 to 8 hours if at all possible, or maybe 6 to 7. Good sleep can help you lose weight if you do nothing else. Good concentration, everything. So sleep well. Take deep breath. When you feel like you're stressed, take a relaxing deep breath. It will hopefully calm you down, even if just a little bit. Okay, if all things fail, here's my last thing that you should do in terms of my kit, the stress reduction kit. Play this up, hit it there a couple times. If you need to, repeat. If you pass out, you can stop the activities. And that ends my talk today. Thank you so much. And at this time, if there's any questions, I'm more than happy to answer that.
Thank you, Doctor. We do have a couple of questions. Somebody is asking, what are the leading causes of falls, and are there ways that we can make ourselves safer at home from falls?
So the leading causes of fall, believe it or not, is at home. Ladder, fixing, going on the roof for the Christmas items, the gutter. So that's the biggest thing. So safety precautions, many times we go up there without taking safety measure, having someone there with us. So before they can quickly call someone to get emergency services. And of course, wearing the appropriate gear for that. So that is one of the leading causes for fall.
We have a couple of questions about exercise. What's the best way to begin becoming more active?
So whatever activities you can do will be great. But at a minimum, walk. Take the time out every day to walk, 30 minutes a day to get the moderate amount of exercise 5 days a week. And if you can't do 5 days a week, then do 3. But add up by 50 minutes and try to add up to 150 minutes per week.
Great. And then somebody else is asking, where should I begin with aerobic exercise?
So same thing, walking, anything that gets the heart pumping. So many times when you do weightlifting, the heart will pump, but not as much as you get aerobic exercise. Walking, swimming, do whatever you find most enjoyable, and then do that activities. If you want to be for sure, if it's aerobic, measure your heartbeat. You can measure here at the wrist, or up here, measure what's your baseline. Or many times we have technology. The iPhone, the Fitbit, any of those will measure our baseline heart rate. And then you should try to increase that by 30%. And that could be a good aerobic exercise. Any activity that does that, including sex.
Somebody else is asking, I've been a lifelong smoker. How do I go about stopping?
That's a great question. And as you may know, that smoking is not easy. On average, it takes around 7 attempts to be successfully stopped smoking. The best way to do that is to use multiple modalities to help you stop smoking, and that's part of that, to seek medical attention from your provider, where they will help you with medication such as Chantix, the nicotine gum or nicotine patch, in combination with other medications. And with that, it's more likely to be successful in terms of stopping to smoke.
For a question here about stress reduction, how can I reduce my stress when I have to work as much as I have to?
Great questions. That's a hard question. If you work double jobs, totally understand, to support your family. So we try to do simple little lifelong sustaining modifications. So at your lunchtime, maybe eat while you walk during your lunchtime. At your chair, try to do simple stretches. And there's many that you can do. It's called desk stretches. So these are the simple stuff. And like for me, my life gets busy after I come home or doing work, so I have to do it in the morning. And all you need is just a little bit amount of time, even 15 minutes. I did mention 30, but at least 15 minutes of moderate to intense exercise can be very, very beneficial.
I think the last question is about heart disease. How much do you have to modify your diet to avoid heart disease?
So a simple 500 calories a day is all you really need. And 500 calories varies from person to person. A Big Mac is probably 2,000, so if you eliminate one Big Mac a day, you've done it. But just simply eliminating that or adding greens. Simple Green. There's a whole science on food and food science, so therefore we can't go into all of it, but just a simple reduction of between around 500 calories a day will give you a good, healthy diet.
Well, thank you, Dr. Nguyen.
Thank you. I put my contact information here. Please feel free to reach out to me if you have any other questions, and healthy living.